Well, hi friends, very good morning. Thank you for joining this. It gives me immense pleasure to have you all here. So before I start, let me just introduce myself. My name is Pratik Shah and I'm an Associate Director at insurancemanager.com. I happen to also heading the employee benefit in this organization. Today we are here to talk about newly launched mobile app which is called IMT, that is Insure My Team for our HR and employees. IMT is a healthcare platform integrated with insurance, convenience, wellness, and healthcare, all under one single roof. It gives me immense pleasure to host you for this webinar. I welcome you all for this session. I'll be also joined by my colleague, Ms. Monica Makwana, who is the Associate Director, and she also heads our CSG vertical, who would be taking us through live the portal so that we can give you the proof of concept and exactly how it works. We have been branded this platform as Insure My Team, and as I told you, is the employee healthcare platform. It comes with the HR portal as well as employee portal, both on web-based as well as mobile app. This aims to integrate your insurance convenience, healthcare, and wellness all under one single platform. Before I take you further, I would like to give a fair backdrop and what prompted us to develop this app, and also, in fact, I would say what prompted us to spend so much heavily on this platform technology platform. Right before the COVID, a lot of corporate had this medical policy lying somewhere in their mail or in the files. The awareness was quite low, as like the employees were not keen to know what are the benefits under the insurance and what all is covered. Who, in fact, not even they were aware who which dependents are covered under the policy. And then suddenly the COVID came in. We saw the sudden spike with the quantum of what we are covering. We saw the spike in the queries coming in from the employees, like they all sort of queries were coming right from the what benefits are covered under the policy, what are the room rents, what is the copay, what are the sub limits, and then the same thing started coming up from the HRs also. So we thought of developing this platform on cloud where the employees and HR can have easy access to the app where they can view their policy related information. They can check the network hospitals, they can check the benefits, who all are covered under the policy. And the entire idea was to ensure that the seamless communication and there is a transparency at what is covered and what is not covered under the policy. And this I would call a convenience for the HR and employees. Second part, as I said, is a healthcare benefit. You will be surprised to know whenever the corporate buys the policy, there are only 8 to 10% of people who actually claim under the insurance. So traditionally, when the policy was bought by the corporate, hardly 8 to 10 people and 10% of people only claim under the insurance. So if there's a life of 100 in the policy, only 8 to 10 people claim under the insurance. The other 90, there was no benefit for them under the insurance. So understanding those gaps, we try to fill, we gave them the healthcare benefits. Where when it's a healthcare benefit, I would call it a restricted OPD benefit. And as a healthcare benefit, we are giving you free doctor consultation. We are giving a discounted diagnostics. We are giving them the discounted medicines. Not only thing, we are giving them the consultation for the plant treatment. So all this benefit we try to provide you through the healthcare benefit, which is very much part of this portal. And third, but last but not the least, the wellness benefit. When I say wellness benefit, earlier what used to happen, like a lot of corporate used to call us asking for the wellness session over there in their client's place. So, for example, one point of time I took a diabetologist for this session. The interest of that particular subject might be very less. So, if I take a diabetologist, the diabetologist will be giving the session on the diabetes. So, in fact, that I would say only 4 to 5 people might have an interest in that subject who might be having those ailment, or maybe somebody in the family members might be having that ailment. The rest 95% of people won't attend the session, or else they won't be interested even though they are there in the session. And doing this session multiple at the client's place is not feasible and not viable commercially also. So what we try to do, we are trying to give these virtual webinars happening every fortnight over here on the multiple subject, right from the yoga, I would say yoga, apart from that, on the ailment wise, hair dental awareness, or maybe I would say the eye awareness, Zumba, and not only this, even in the financial year ending, lot of sessions are happening on the taxations also. So this is something we try to get this all the three benefit under a single portal, which we call it IMT. So for this next, I would hand over this session to my colleague Monica Makwana, who will be taking you through the live, like how this portal looks like and what are the benefits available in those portals. With this, I would hand over this mic to Monica. Monica, thank you very much, and you can take over.
Thank you, Pratik. Thank you. And thanks everyone for being present on a Saturday morning. I'll share my screen. So basically, this is the page how it looks for an HR portal. First of all, I'll brief you through the HR portal and employee portal both, where the insurance convenience details are there. This is the page where the HR will have a view. HR being an employee of the organization will have two view. One is from an HR view where he or she will have an entire preview of the policy right from how many lives are covered, what is the claim, count of claims, all the endorsements that are happening, everything. Apart from that, on a first dashboard, they'll have the numbers and the details of all the contact person who are, serving and day to day in touch with your policy details. So this is basically an HR view or demo view of my organization, where you can see we have a two corporate policies. So all the policies are being uploaded on the portal. One is GHI policy and the second one is a GPA policy. Now, if you want to see the coverages, you can have a coverages over here, which it will show you the policy number. From this cloud icon, you can download the policy also, which is, readily available and uploaded on the portal. It will show you the end date. Policy covers policy definition, which covers, self, spouse, two kids, and two parents. Who is the TP? TP is Health India. It will show you the cadre-wise sum insured, which is available in the policy across the policy. So we have two sum insured slabs, which is 2 lakh 50,000 and 5 lakhs. Room rent condition is also mentioned over here. Maternity conditions are mentioned over here. ICU limit is also there. If there is a corporate buffer applicable under the policy, we have a limit mentioned over here, which is 4 lakh. And what are the various add-ons which we have taken under the policies, like, pre-existing diseases, pre and post hospitalization, ambulance charges, the policy overview, whatever is covered under policy would be given over here. And what is excluded is also being mentioned in the second page. What is not covered, like LASIK treatment, OPD treatment is not covered. Any kind of foreign treatment is not covered. Dental treatment, all such benefits are not covered, which are also seen and available over here. Now we go to member tab. Member tab will show you that what is the current as on date total number of lives covered under the policy, total employee counts, how many spouses are there, how many kids are there, how many parents are there. HR will get in view of entire thing, will show the CD balance also, because of late, HR or admin calls up anytime and says, Ki Monica, please share the CD balance. We need to submit it to the accounts department. It is asking for the same. So the even float balance is being uploaded over here, and those can be downloaded here from the download buttons given over here. And the HR can see who all are active and who all are being deleted from the policy is also seen. Apart from that, if you have any request which you where you have to add the member, you have a tab button. You can upload the single uh, Excel sheet over here, where the format is predefined. You have to just fill in the details and submit, and we'll receive an addition deletion request, and then just one phone call to remind us that the addition deletions we have uploaded on the portal, kindly check and process the same. If we have a single entry, say for example, there is an addition due to birth of a new child, and spouse by a marriage can be made by an single entry also. So it will show you all the active members, pending members, if any endorsement is in process, or the count of employees which are being deleted are also being seen over here. Policy details we have already seen, like how many policies are there, what are their coverages, and sum insured is being reflected here on this button. Then we go to an hospital button, because whenever there is an hospitalization, an employee comes up to an HR, or employee directly calls to the dedicated sales manager or a claim manager stating that, madam, please let me know which hospital is in network in my area, or they share the name of the hospital to us and we check and then tell them, which takes time, you know. So if you have an web access or an or an app or handy over you, it would be a just a way to button click. See, if you type a pin code number here, it will show you the entire list of hospital being listed on that pin code, so you can choose any one of the hospital and get the cashless network done. Of late, we have uploaded the blacklisted or an excluded hospital list also, which is very important because any treatment taken in this listed hospitals is not covered by the insurance company until and unless it is in life threatening treatment. So this is also very important to, look at, because sometimes in emergency the employee gets admitted to the hospital and then later on we get to know that it was in blacklisted hospital and the treatment is not covered. Okay, then we have a payment schedule, like it will show you whatever addition and deletions we have done and the payments which were done by you during the policy period. It will show you along with the date of addition, name of the employee, and their uh, for employee breakup is also mentioned over here, where you can see this many people were added, this were deleted. So the entire list will be handy with it, because before any addition and deletion every month happening, HR calls up, Monica, last month ka active data bhejo, I want to share you, and addition deletion for the next month. So for such small queries, you need not depend on us, or follow up with us. It is all available here because this has been uploaded on a real time basis, so it can be available over just click of a button. Then we have a broker tab where you can see your claim details also, like how your policy is behaving during the year. So it will show you the total claim amount, count of claims, paid claims, cashless claims, reimbursement claims, along with the employee wise breakup ki who has claimed, when it was registered, it is paid, or it has been declined, or it has been paid. Apart from that, you can also download a settlement letter also from the tab which it is shown. Like if you see view documents, your settlement letter will be also be seen over here. See, this is the settlement letter. Apart from that, you can also check the timeline, like what was the timeline when this claim was settled. It will show you all the activities date wise. So you can keep a track of that also. If any employee comes and says that there was a delay or my things are not moving, even these details are handy over here. Now, if we go to claims report, we will be able to see the claims analysis report, like what was the incurred claim amount. And then we have various analysis done, cashless versus non-cashless, relationship-wise split is given. Like in our case, it is self have claimed around 6.3%, parents-related claims of around 56%, and kids-related claims of around 6%. So it will show you, and relationship analyze or analysis also. Disease-wise analysis are also available. Then we have a month-wise breakup also, like in which month there were how many claims. Okay, age wise and sum insured wise breakup is also given over here, and the same report can be downloaded through export to Excel. Again, here all the details, employee wise and relationship wise have given that who all have claimed under the policy. So this was an entire overview of the HR, where HR will able to view and see from this. Then one switch button is given to an HR where he or she can switch to an employee mode, where only just his or her details will be available in this space. Okay, if you go to policy details, you can see that I have been given a GHI and GPA policy from my corporate. So what is the definition in the policy is also given. So if you see what is my sum insured, that particular employee sum insured, policy number, TPA, all these things are reflected over here. Who all are covered under my policy? Say, for example, for myself, daughter, mother, and father are covered under the policy. If I need a car, because very frequent query we get that also, that what are ma'am, I need a card in a urgent. I have an hospitalization in my family. So you can download an health card over here also, which is downloaded over here. See, this is the health card which has been downloaded. So it is all handy. Apart from that, I'll again have the hospital access to an hospital network list, which is next important thing for me in case of emergency, and the coverages, because many a times employees come up and ask, madam, what is my sum insured limit, what is my maternity limit? These are the frequently asked questions, so this all would be here handy with them. All the coverages and everything is given over here. This is the policy benefit, this is the policy coverages over here. On benefit parts, there are few, wellness and care benefits which are been uploaded in the portal, through which in detail Pratik will run through us. So I'll skip this. Then we go to claims. If the employee has made any claims, it will show you the claim details also over here. In this case, there is no claim, so it is not showing. If you want to know the claim process also, you can see here the tabs are given for cashless claim, pre-authorization and reimbursement. Cashless claim is very easy, like you have to approach to the hospital billing desk or a TPA desk, and they'll ask you for few personal documents like PAN card, Aadhaar card, and the rest of the procedures would be done by them, wherein they'll fill the pre-authorization form and send it to the TPA, and the cashless would be done. So this is that process. Pre-authorization letter will also be given in case, if you have shared the request of say around 50,000, then initial approval would be given of around 20,000, would be given of 20,000. So you need not panic. Go ahead and take the treatment for the patient and get the cashless done. In case of reimbursement, at the name itself suggests that reimbursement means that first you incur the expenses, and then though you go get those expenses reimbursed from the insurance company. So how to claim that, what is the list of documents which are to be submitted to get the reimbursement is there, that like you have to share the claim form and original along with the original sign and stamp from the hospital, original discharge summary, original final bill, and all the reports, diagnostic papers, indoor case papers, and everything has to be submitted and original. So even this is handy with them, where you can know that. Apart from that, if you want to connect with a claim person who is a dedicated claims person to you, even his or her mobile number, email ID, and name is also available on the portal at this page for an HR in case of emergency. From here onwards, I hand it over to Pratik for the next part of wellness and care. Over to you, Pratik.
Well, thanks, Monica, for briefing us about this IMT portal, especially with the insurance convenience. So as I take you further, as I said earlier in the briefing, like as we incorporate the healthcare into this portal. So as I said earlier, also I'll repeat that thing. That hardly there are 8 to 10% of people who actually claim under the insurance. So what are the benefit for other 90% of people who are not claiming? So this is something which we thought and added this, which is only helping them, the employees and their family members, where they are saving certain expenses incurred for the day-to-day medical treatment. So when I say, first of all, I would like to start with free doctor consultation, where you can see over here, we are providing the free doctor consultation for minor things like fever or maybe the cold, cough. And if you want the specialized consultation also, that is also available on the discounted price. So you can see, if I just click it over here, it will give me the entire list of doctors who are available over here. Even though it is currently showing the charges, but for if you consult them for the minor thing, it will show as a free consultation. There will be no charge for those expenses for those consultation. And this can be done by your employees or maybe for the dependents whenever. So traditionally what used to happen, if there is any employee suffering with minor thing like cold fever sort of thing, usually used to go home and then visit a doctor or maybe a physician very close to your residence. Especially some in the rainy season, you might feel a lot of crowd there in the clinic with a viral thing. So people tend to avoid going to the doctors and then elongate that ailment, and then which might resulting into certain hospitalization. So with this online consultation, this has been available over this portal where you can have this consultation done at the convenience of at your residence. तो आपको कुछ नहीं करना है, खाली यहाँ पे क्लिक करना है, and then you fix up the timing for your consultation, maybe within 30 minutes, 1 hour, whatever time you're comfortable. And this consultation can be done through portal, mobile. You can this consultation can be done through WhatsApp call, or video calling, or telecalling, whatever you comfortable you are with. Next, I would say, so once the consultation is done, doctor might prescribe you certain medicines. So for the medicine, we are tied up with Tata 1mg, where you have to just upload your prescription, mention your address, pay the discounted pricing, and the medicine will be delivered to your residence. The doctor might ask you to undergo certain diagnostics. So for this diagnostic, we are tied up with the Healthians, where you can avail this diagnostics on the discounted price, which are up to 50% off. You just have to upload your prescription again, mention your address, fix up appointment. The person will come to your residence, collect the samples, and then simultaneously the reports will be delivered to you through the WhatsApp. So all these things are available over here. Apart from this, we have tied up with Pristine for surgery care. So when I say surgery care, the plant treatment, you can consult over here on the Pristine with the guy over there who might be available on the phone call. You have to just mention your type of ailment. They will guide you through the which hospitals are under the network, understanding your policy, what room you need to opt for. They will check all the benefits of your policy and suggest the hospitals and rooms. Simultaneously, on the day of surgery, they will pick you up from your residence also, and the same thing on the date of discharge. They will take you to your residence also through the personal vehicle. Apart from that, we are giving you personal hygiene products on the discounted price. Uh, we are tied up with Food Darzi for the health and testimonials. Apart from that, we are giving you eye consultation free of cost through. We are tied up with Dr. Agarwal. So in case of any eye consultation, you can consult this clinics which are very close to your residence. You can check over your on the portal and fix up your appointment, visit the clinic, get your eye consultation done free of cost. Simultaneously, we are also tied up with Glow Dental for your dental consultation, which are again the free of cost, and you can avail this benefit through this portal. So you can see a lot of your minor expenses which are normally incurred day to day life can be either you can have those things free of cost or maybe on the discounted price. So next, I would like to take you to the wellness session. The wellness is nothing but where we are doing the every fortnight we are doing one certain wellness session on the subjects like Zumba or yoga or maybe n number of sessions are happening. So you can see these are happening every fortnight. So every 15 days there is one or other session happening on the virtually on this webinar. So next session we are lined up on March 6th, wherein you can say there is something related to eye, wherein this session will be taken care by reputed doctors over there. Every employee who are onboarded into the system will get a mail asking them to register. And once if they find the subject interesting, they can register themselves. And the sessions link will be again mailed to them. And then at the day of that session, they can attend the session live on the virtually. There may possibilities that person might not be free on that particular day. So nothing to worry. Once he has registered, he'll get a link. So he can again, once the session is completed, he can have the session again view by individually on the weekend at a convenient time. So you can see also the past events, whoever registered will be getting the link and they can view this sessions at their convenient time. So this is happening every fortnight, every 15 days, and I would like to see that people take the benefit out of this. Apart from this, as I said earlier, we are giving you them the lot of other benefits. So we are giving the top-up policy, individual top-up policy also over here. So if people wish to buy the personal insurance, wherein if the corporate has opted them the sum insured of 2 lakh, 3 lakh, and they wish to have the sum insured, more sum insured under the policy, they can buy this policy over individually on the individual front. We are giving you maximum sum insured, that is 20 lakh as of now, with a certain deductible. So they can understand what is the base policy sum insured, and accordingly they can deduct their deductibles. So for me, for example, if I see my sum insurance, my base sum insured is 5 lakh, I'll take a deductible of 5 lakh, and then you can see the dependent, with the dependent premium, the premium is calculated, which is showing me for the from 20 lakh sum insured, I have to pay the premium of 4274, which is including the GST. So these options you can see, you can buy this policy individually on the individual front, and nothing to worry. Even if you leave the organization, you can carry this policy along with you. Along with you, this has nothing to do with the your corporate policy. This is your personal insurance, and these premiums are basically on the discounted price. So this is something what we call it a IMT, wherein again I would say that this is something which gives you insurance convenience and healthcare and the wellness on single platform. This is available on the cloud, so you wherever you can avail this benefit from your comfort zone. So this is something which is all about the IMT. With now, I would like to see any questions coming in from anybody. If there are any queries or anything which is related to this app, I can surely you can put it on the chat box. I'll be more than happy to answer those queries. So I don't think so any queries are coming in. So with this, I would like to hand over this to my colleague Monica Makwana for the vote of thanks. Over to you, Monica.
Thank you, Pratik, and thank you all the participants for giving their valuable time to attend this session on a weekend. Hope this session was quite educative and knowledge and gave you a lot of understanding on how the product was defined. Down the line, due to the time constraints, if there are a few doubts or query which may come later on, we'll be happy to answer those over a phone call or meet in personal to resolve your queries. Once again, would thank on behalf of insurance manager and Riverbank insurance brokers to attend the session and look forward to connect with you over the same. Thank you, Pratik.
Thank you, everyone. Thanks.